Okay, so we're having some technical difficulties. We're back from the break, and I guess we're having a little technical difficulties with the phone. So if they can figure out a way to get this thing worked out, we certainly will. And I think the information I have is Ray had tried to call in and was on the phone, and he wanted to talk about penicillin. And I'm not sure what he wanted to talk about with regards to penicillin, but as you know, it obviously was the first antibiotic developed and is still very useful. The injection part of it, we used to give a lot of penicillin injections, but we don't anymore. A lot has to do with once you give an injection, you can't get it back. And penicillin G was given, God, it's like glue. Very useful for chlamydia, CLAP, or gonorrhea. And syphilis, very sensitive to that. But we've just kind of moved past that, and penicillin might make a resurgence. I know one of the drugs that actually made a very good resurgence against methicillin-resistant staph was Septra, sulfa drugs. Found that the MRSA was very sensitive to sulfa, which was a little enlightening. But again, and I've talked about this previous on the show, that methicillin-resistant staph, a lot of people get those infections, and they're due to the overuse of the hand cleaners because they basically kill all that good bacteria on your skin. So be careful if you're using those hand cleaners. This is what you want to do. Use them on the palms because you still have the normal bacteria in the back of your skin, and it can repopulate, but it can kill some of the viruses. And remember, during cold or flu season, touching your face is one of the most dangerous things you can do to help because you're going to be touching different things and picking up the virus and then putting it on your face and then getting it close to your skin. And I talked about that during the Ebola crisis. Black elderberry, very good for like a Robitussin to help some of the congestion. The other thing is colloidal silver. Colloidal silver. Well, I've seen colloidal or ionic silver. I remember visiting a patient who basically was taking silver wire, putting it on a 9-volt battery, putting it in water, and you could actually see the ionic silver going from the silver wire into the liquid, and he drank a glass every day. So he was sure that it helped him with his COPD, and in fact, as I was reading, it's been indicated for a lot of different indications. But one of the indications that I found very useful, that it may inhibit the ability for viruses to replicate or attack to your skin. So there are some side effects from colloidal silver. You know, the overuse can cause a bluish hue to your skin, and some of the medical journals and a lot of the things report that the benefits of colloidal silver have never been documented, and they're in what I would call the Journal of Irreproducible Results, meaning nobody's ever done a double-blind crossover placebo study. So again, colloidal silver, I've tried it myself, and I can tell you that at 500 parts, it comes in different concentrations, 500 parts per million, 2,000 parts per million. I've tried the 500 parts per million. I'll add it to some yogurt. Not that I feel like I'm getting sick, but I think in the interest of if you felt like you were getting a cold, it might be a very useful thing. I find that if you take more than that, you may get some body aches, and you may actually get some skin reactions. So you can feel it doing something to your body, whether it's good or bad is indeterminate. But there are a lot of people that believe in colloidal silver, and I by no way claim to be an expert. I can only tell you my own personal experience when taking it, what it does to me. The other products are echinacea, and we know for a long time echinacea is a medication that can help with cold and flu. The zinc may be helpful from blocking the virus from attacking coldies and airborne and things of that nature. And then there's ginger root, which may be very helpful in blocking some of the gastrointestinal side effects. It's a GI settler. And there is a bee pollen, which helps to sensitize your allergies and your runny nose, and activated charcoal. So I know I gave you a lot there, but let's go over them again. Sambucol, black elderberry, maybe a teaspoon or two, twice to 3 times a day for cold and flu symptoms. Colloidal silver in small amounts. If you're getting symptoms, 500 parts per million, probably no more than that per day. And initially to try and keep that virus from taking hold in your system, in addition to the activated charcoal, helping to absorb some of the toxic agents that might be in your system. Ginger, echinacea, usually 2 caps of echinacea, 1 cap of ginger. A couple caps of ginger may cause maybe as many problems as it can solve. And again, some of the overborne products. I think some of the stuff that I can't remember the name, but it was like a thing you coat your sinuses with. I was using that at one point. I don't think it really did very much, but the important thing is, again, to be eating right, to be getting plenty of rest, keep your immune system intact. If you're sick and you come into my office, we're making people wear masks to try and reduce the spread, and you should do that. I mean, if you're developing a runny nose and you feel this like scratchy throat and your head's getting congested, you really should be aware that you're getting sick, and you really should be putting a mask on and trying to limit your exposure and spreading illnesses. Good hand washing, stay inside. I've told my employees, if you're sick, don't come to work. I mean, we don't want you spreading it to everybody else, and you need to be aware that you may be getting sick. And don't overuse your hand solvent. Don't use your hand solvents. It's very important to practice good cleaning. Soap and water has been around for a long time, and it works very well. Too many uses of antibiotics, so the stronger the soap, it kills normal bacteria. Remember, we need bacteria, and one of the things you can do if a doctor gives you an antibiotic is make sure that you are using a probiotic to help protect your gastrointestinal flora and being able to continue to digest. I mean, we need lactobacillus to be able to digest some of our food, and we don't want to get an overgrowth of certain bacteria in our intestinal tract and get an infection or, an antibiotic resistance, or basically even getting a bowel infection. And one of the more common, really nasty bowel infections is C. difficile. It's an invasive bacteria that is only created when you're being given another antibiotic that kills the good bacteria in your intestinal tract, and then you get this invasive bacteria, and that's a very dangerous situation. And along those lines, other invasive bacteria in your intestinal tract, we've heard all of Salmonella and Shigella. Salmonella, or typhoid Mary, is typhoid fever, and that was again created. It can be created by giving somebody too many antibiotics for a long period of time. You can actually select for resistant and strange bacteria. So antibiotics for short courses, for short periods, for the appropriate time, and don't feel bad if your practitioner doesn't give you an antibiotic unless he doesn't have a good reason for it. Most of the time, I'll tell my patients this is a viral infection and antibiotics are not going to really help you. But if I do give you a prescription, it's because I don't want you to have to come back in a week later because you develop a secondary bacterial infection and use certain signs and symptoms together before you take those. So I know we had phone difficulties tonight. Hopefully, if you had a question tonight, you can keep that in mind so that we can bring that up on the next few shows. And when we come back from the break, which will be in just a few minutes, I'll have that slide up for you that shows those products that I talked about. And I'm probably going to talk a little bit about maybe starting to get into some high blood pressure issues. I want to talk about hypertension and some of the definitions of things that I talk to patients about. about high blood pressure, and I'm going to go on a little bit of a rant about this prescription issue again. I had an interesting conversation with one of the pharmacists here locally in town who was talking about some of the things that his corporate office might be doing or considering doing, which I found very very disturbing. So if you're an opioid taking patient, meaning you take pain medications, you might want to pay attention to this. This is actually getting, I think, way out of bounds for what might be coming down the road. And so this is very important for you to pay attention to. I know I had discussion with one patient in my office. They actually said they were listening to what I was saying. So at any rate, we're going to go to break, and when we come back, we're going to talk about those things. And thank you again for tuning in.